Women are far more likely to be iron deficient than men, and now a report from the University of Michigan is finding 4 out of every 10 teen girls and young women do have low iron levels, low enough to cause some symptoms like dizziness, sometimes low energy.
Yeah, well, Dr. McGeorge is here with what to watch for and how to get tested and how to treat iron deficiency. Hey there, Dr. George.
Hey, Karen and Demond. Yeah, so iron is essential for our hemoglobin, which carries oxygen in our red blood cells to function properly. In fact, about 2/3 of the iron in our bodies is actually in our red blood cells. The rest is used in other functions throughout the body. Now, low iron levels can come from poor dietary intake or problems with iron absorption, but more commonly, it's actually blood loss.
In our study, we found that almost 40% of 12 to 21-year-old females had iron deficiency.
According to Dr. Angela Wyand, a pediatric hematologist at U of M Health CS Mott Children's Hospital, people can experience a wide range of issues even before their blood counts drop.
Low iron can include things like low energy or fatigue, as well as things like hair loss, sleep disturbances. But a lot of these symptoms are nonspecific, and so patients may not recognize them as abnormal.
Their research also found that the rate of iron deficiency was higher among Black and Latina young women, as well as teen girls and young women who had already begun having periods. Wyand says menstruation is a common risk factor for iron deficiency and needs more attention.
It's one way where patients can lose a lot of iron, whereas typically patients who are not menstruating just lose a small amount of iron through their skin. So it is important for patients to know what a normal menstrual period should be like, and if they are falling outside of what that normal is, to definitely talk to their healthcare provider about that.
Testing may include a routine blood count as well as a specific test.
So there are lots of different tests for iron deficiency. In our study, we specifically use ferritin, which is a marker of iron storage, and it's kind of the universally accepted measure.
Ways to increase iron levels include eating iron-rich foods like meat, eggs, fruit, and spinach. Iron supplements are also available over the counter or with a prescription.
Now, one final thing I want to mention, you should talk to your doctor if you're going to start an iron supplement, since they can cause side effects, primarily intestinal, and it is actually also possible to take too much iron.
All right, Dr. Franks. So how often is iron deficiency so serious enough that someone may actually need a transfusion?
Well, you know, it does actually happen periodically, but generally blood counts with iron deficiency drop over a fairly long period, and if we replace the iron, the blood counts come back up. We try to avoid transfusions, but if someone's hemoglobin becomes dangerously low, we will give blood until they can actually generate more blood on their own with a replacement of iron.
Good update. Thank you.
Common. All right, thanks, Doc.